The webinar is streamlined live on our YouTube channel, that is incubator@IITK. It's a great pleasure for me to introduce our respected keynote speaker, Professor S.K. Mishra sir, founder, School of Telemedicine and Biomedical Informatics, who is going to talk about telehealth opportunities and challenges in India. Also, we have with us Ms. Aditi Kumar, AVP Bioprograms at SIC IIT Kanpur. Before we begin, I would like to introduce you all to our keynote speaker for the webinar. Professor S.K. Mishra graduated from PGI MER Chandigarh in 1983, after which he moved to Sanjay Gandhi Postgraduate Institute of Medical Sciences, SGPGIMS, Lucknow in 1989, to establish the first academic department of endocrine surgery and serve as dean. He was also involved with several renowned institutions as a consultant like ITU, WHO, Government of India, and the UN Nations e-Health. In June 2021, the Indian Council of Medical Research appointed him as an emeritus scientist to carry out research in the field of telemedicine and digital health as SGPGI Lucknow. Presently, Professor Mishra is serving as a distinguished visiting professor in the Department of Biological Sciences and Bioengineering at the Indian Institute of Technology, Kanpur, to support the development of Center of Excellence in Telemedicine and Healthcare Robotics. I welcome you, sir, for this session.
Thank you. Good afternoon to all faculty and students at the IIT campus. It's a pleasure to talk something about telemedicine. The subject is close to my heart. I can have a PowerPoint. Just sharing your PowerPoint. So the topic assigned to me was the opportunity and challenges of telehealth in India. So I'll be focusing my total content focused on India only. And you know, the telehealth or telemedicine is very loosely interchangeable term. This is very, very common now knowledge for all the people, starting from child to adult, everybody, because of the COVID. So COVID has catalyzed the term telemedicine to 1 hour. So when you talk about the telemedicine or telehealth, it is an integrated digital technology platform involving information science and communication technology to exchange health information. This particular terminology, telemedicine, telehealth, e-health, m-health, so many terminologies are interchangeable. And in each of these terminologies, there are only common platform. They mean everything same, but there are three common platforms. There's a physical separation, that is the always constant factors, physical separation between the caregiver and care seeker, and the network and IT. The third is the health service. These are three pillars of any telemedicine process. Many of the digital technology has evolved recently, last couple of years, which is added to the health domain. Now we have broadened the terminology of telehealth, telemedicine, e-health to a digital health. Those are the things very familiar to all of you: sensors, IoTs, big data, cloud, AI, machine learning, AR, VR, and high performance computing. So all these things are now contributing to the entire umbrella term called digital health. Though the concept of remote health monitoring is known since space exploration, but the real value of virtual care is realized during lockdown imposed due to COVID pandemic. Coming to the application scenario, anything that you are tele to any discipline, medical discipline, it becomes a telemedicine platform. Like a telecardiology, if you want to do something relating to cardiological consultations or any process related to cardiology, like transmitting ECG or transmitting angiography to remote places. Same thing happens for radiology, dermatology, pathology, so on and so forth. However, there is another situation where telemedicine is being used, especially in a enterprise manner, where you want to monitor remotely. We call it remote patient monitoring, tele-ICU, or you have a group of elderly men in a geriatric home to have a tele-home care, or you want to monitor the health of the astronauts. So there are also space medicine coming to the picture. Some of the interventions are also done using telemedicine technology. You might be familiar with the Da Vinci procedure of robotics, where in remote regions of Canada, they apply this for telerobotic surgery. You use telemedicine technology for mentoring remotely, for telementoring. You want to manipulate some device, telemanipulation, or you want to do anything doing with your bandwidth, high bandwidth procedures, interventions that you can do it. We have several such examples coming up in the last few years. The remote diagnostics based on inbuilt AI-based system. Nowadays, many of these imaging equipments are built-in AI systems. Now, as you very well know, the AI systems are based on pattern recognition, and these things are inbuilt into the ultrasound or any radiology equipment like CT scanner or MRI, where automated diagnosis are also possible. Now, the cloud architecture has helped in deploying a minimal infrastructure and maximum in the back-end support from a third-party agency. So all these cloud-based, internet-based devices of sensors are now making the telemedicine process very easy, not very expensive. And you can cater public health in large numbers. We also have examples of telenursing, telerehabilitation. Sometimes telerehabilitation also use AI-enabled robotic systems. And teleeducation is very commonly used in the health professional education. Now it has gone in a very, very high-end systems using AR, VR, and also coming generation may see the metaverse playing a role in giving a simulated environment for professional education. Now, coming to the opportunities that we are now going through in India, I'm focusing my presentation in India only. So you have very good ecosystem now to deploy telemedicine. So we should not miss out this chance. We already have tested benefit of telemedicine during pandemic, and it's going to stay. It is very ideal for primary care. For primary health centers, sub-centers, we do not have manpower, especially doctors are not there. So we can really use the community health workers, like the non-doctor professionals, like nursing or paramedical workers. We can train them to handle, which has been commonly done nowadays with community health center through National Health Mission. I'll talk about that later. So where we can get the patient information and give them advice, they can execute the advice from a larger medical centers. We have several such examples on Prime Minister's Ayushman Bharat Health and Wellness Program and e-Sanjeevani online OPD. Again, I'll talk about it later on these two products. We can also monitor the patients who are discharged early. It's a very common practice in overseas, where the hospital admissions cost a huge amount. In our country, the patients don't like to go back to home very soon after operations. But we have done several research where you have shown with good outcome. They can be discharged and they can be followed up through telemedicine. So this is possible nowadays. We have to just change the mindset of the patients and their families. So you can generally monitor them remotely from their home. You can review their investigation reports that you asked for it. You can change the drugs, whatever you like to do. So it can reduce the readmission rate if you follow this technology. Other thing that is very important to mention is behavioral health. You might have heard recent budget declaration where 470 crore rupees has been sanctioned for telemental health deployment, in which the NIMHANS in Bangalore has given the responsibility along with IIT in Bangalore. They are going to develop this solution and deploy in peripheral centers all over the India. It's a pan-India project. Treating chronic conditions like diabetes, hypertension, cancer, stroke, etc. is possible through telemedicine without compromising any safety measures. You can remotely monitor. You can also introduce drug alert systems. There are so many things that you involved in the managing these patients that can be run through remotely. During pandemic or epidemics, physical distancing is a norm that we have observed during COVID times. We have to track symptomatic people, and also we have to track people who are spreading infections. So these are very, very important things which you have done during COVID times very satisfactorily. You could follow them up. We allow them to stay at home. We monitor their health. All these things are possible through telemedicine. A telehealth solution is ideal for self-management of chronic diseases in elderly. If you can teach them some digital skills, you can really convince them, they can jolly well talk to somebody on video, like a WhatsApp video. They can call and talk to them and tell them about the blood pressure value or the sugar values and alter medicines staying at home. These kind of things are very commonly done in overseas countries where the doctors are not in the picture. There are clinical practitioners, they're basically trained nurses that take care of these things. This is possible in our own country too. There are real estate companies now, they are coming up with dedicated geriatric households. So there also can deploy such kind of solutions, and centrally we can monitor these older people. And this can be clubbed with security and other anti-fall systems, etc., to monitor these families. Now, the pandemic has forced individuals and healthcare systems to review what is possible and desirable and to adapt models of care in changing situations. That we have done in COVID times. We have experimented all kinds of tools, all kinds of processes, and just an audio consultation without a video has made a lot of changes. Now, COVID pandemic observed a shift towards telephone and video consults. Patients, family, self-managed people at home, assisted by pulse oximeter and oxygen therapy. This is well, they are forced to do it, and many patients we could really save them. Potential to reduce burden on the health system by reducing the inpatient care. The mere footfall also can be reduced. That itself make the health systems very comfortable. And if you can reduce the number of admissions in the hospital or discharge them early, that itself also reduce the burden. These things are not so important nowadays in our country ever, or it will happen in the future, I don't know. But in overseas, because the patient care costs are borne by the insurance company, they take it very seriously. And I'm sure with the next generation of health system coming up in our country, with the National Digital Health Mission, these things will become a practice. We have new technologies also and tools. You have seen those things are deployed in the COVID times. Telepresence robot, we have done sanitization through robotics equipments, and remote patient monitoring was the rule, not exception. The pandemic has led to improved computer literacy and access to technology. These changes are removing the barriers to telehealth and creating opportunity to rethink its roles. It is well proven that what we could not achieve in 20 years, that these 2 years has made. All of our friends who are very much enthusiastic of telemedicine, we always get depressed why the government is not adopting telemedicine. Now you see in 2020, March 25, they announced the guidelines for telemedicine. So though it will happen much later, but at least we could see that telemedicine now is legally possible to practice. Now there is a lot of opportunity to integrate technology. This is specifically meant for the IIT campus, for all of you to take a note of it. Now technologies to support telehealth are proliferating. Every day something is coming up. It's not only technology, it is a solution. Now wearable devices, the IoTs, smartphones, smart homes, cloud solutions, they are very much in the vogue. Now the smart homes can be equipped with environmental and personal sensors. Those are interconnected using Internet of Things. These devices can monitor patient health and send messages to responsible clinicians when emergency situations are detected. Novel methods of capturing, curating, and analyzing data are being developed. This is one of the projects I've suggested here in IIT under the Center of Excellence in Telemedicine. We can take it up. This is doable, and we can make a model, a cost-effective model to suggest government or entrepreneurs to transfer to industry. Especially real estate companies can be convinced to make these smart homes, and they can offer to people who have long-standing medical problems or old age. Now, telehealth is not just about technology. Delivery requires change in the working practice, and curating the data, COVID has proved it possible. Now, I'm specifically focusing some of the points related to the policy and strategy of the Government of India. This is very important to know that this strategy and policy led to allocation of budget and led to clear-cut governance instructions to all the states to adopt these things. This has made the entire ecosystems very conducive for adopting telemedicine. First, I would like to take is the telemedicine practice guidelines. That is a very landmark date for us. All those are enthusiastic of telemedicine. 25th March 2020, when the first phase of COVID came in, and in a very short time, I think it's emergency measure, they introduced this, and Medical Council has approved. Though it is in a very, there are a lot of revision required now. We have raised those points, but at least something we had in the hand, and that can be modified in due course of time. This is available in this. I've given all the links. You can go there if you're interested to know about it. We have a national health portal of the government where many kind of promotive measures and information about hospital and healthcare facilities are available there. Information on the blood bank, all those things are available in there. We have also a portal dedicated to online services by the government of India and their health systems that you can go through. And recently, something has been introduced, which is very, very important for all of us to know, is the guidelines for telemedicine services in Ayushman Bharat Health and Wellness Center. In this, they are adapting this community health centers. There are 250,000 odd community health centers, and the people who are deployed there, they are trained nurses. They take 6 months of training in National Institute of Health and Family Welfare, and they are the community health workers, health officers. So they are given directly opinion about from there. This is again a software developed by Sridhar Mohali being deployed there. It is eSanjeevani Health and Wellness. And eSanjeevani also introduces software, something in the first phase of COVID, and it is adopted by the government of India as a national free teleconsultation service platform. And it is available in the eSanjeevani opd.in. All details are available there. You can go through that. This is very, very useful. I'll show in the next slide the number of consultations being happening in this. This is deployed by the state health missions. And the latest thing that is happening is the National Health Authority under Ayushman Bharat Digital Mission. You might have heard recently, though it is announced by the Prime Minister on August 15th from Lal Killa on 15th August 2020, National Digital Health Mission. Now you have the National Health Authority, and it is called Ayushman Bharat Digital Mission on Government of India. So you will find in this website a lot of information available. Please, if you're interested, go through that. And this is the data I want to show you on eSanjeevani online OPD. You can see here from 2020 it introduced, and how it has taken a crescendo, and it is reaching a huge number in millions in February 2022. This is the slide I got today from Sridhar Mohali. This is very latest information. Next thing is the top 15 states, they are adopting this eSanjeevani online OPD as well as eSanjeevani Ayushman Bharat Health and Wellness projects, and these numbers are also climbing. This is again an important information slide, Ayushman Bharat Digital Mission, in which the Government of India has introduced a system where you can have a digital health card. We call it ABHA, Ayushman Bharat Health Access. It's just like Aadhaar card. And now you can see here, total 21, I don't know how many crores. So 21 crores, I think, population has been already registered under this ABHA. And the ABHA number is a hassle-free method of accessing and sharing your health records digitally. It enables your interaction with participating healthcare providers and allows you to receive your digital lab reports, prescriptions, and diagnosis seamlessly from verified healthcare professionals and healthcare providers, health providers. See, now you can get all the services from the dedicated hospital. But what ABHA is going to do is, wherever you are getting treatment, your reports are available to you, wherever. And the reports are available to the doctors who are going to see you, even if you change the city. Currently, we have to carry our investigation, we have to carry our X-ray, CT scan, everything. But in the future, we will interoperable platform will there found India, where you don't have to carry a medical record. You just go and tell your number, our number, and with your consent, your service provider in different city, they can access your entire health record. Of course, there are issues of privacy, security, all this that is getting worked out. This also National Health Authority also have facilities for registering health facilities, and also you can see some of the data already available in the website. So they have also facility for registering doctors. Also the ABHA mobile app download they have already introduced, and there are also inviting industries to come and join and help this health authority to develop some of the applications and integrate it into the national platform. Already there are integrators already registered, and 34 already successful integration has been done. Coming to the challenges that we are facing now, are going to face in the future, which needs to be mitigated. While telehealth have a positive effect on patient safety and outcomes, it comes with a risk including exacerbating the digital divide, poor software engineering, and security breaches. Future telehealth platforms must be secure, reliable, and flexible enough to accommodate regulatory, professional, and healthcare organization requirement. These platforms need to be updated regularly. To realize full potential of telehealth, patients and professionals must trust digital systems to keep health information private and secure. There's always this risk of getting this security risk. Even when we transact a bank, also we are very scared. Same thing also when we transact for our health information, we have to be very, very careful about that. And the data protection bill has not yet been approved by the parliament. We're waiting for that. To optimize digital solution inclusion, telehealth solutions must be easy to use and maintain, which demands availability of good internet communications. We hope that in the coming generation of network, especially the wireless broadband network, 5G, will mitigate this problem. And it has to be, any solution you offer, it has to be affordable to the individual as well as the system. After mitigating challenges, key to good outcome of organizational responsibility. Now let us see what organizations should do. Early adoption of telehealth have traditionally been remote communities with sufficient access to the traditional healthcare services. The outcomes and experiences of telehealth are dependent on design details and factors such as health literacy and digital literacy, and the quality of integration with the clinical care pathways. Because it's very difficult to change the attitude of doctors if you deviate from the standard protocol of clinical care. To realize long-term benefits of telehealth, organizations need to collaborate and learn what works well, where, why, and how. Government need to support the health technology industry in developing and testing novel telehealth solutions that are simultaneously safe and agile. Mitigating challenges, key to good outcome. Let's talk about industry responsibilities. Industry needs to work with professionals and patients to ensure digital inclusion, data security, and solutions that are intuitive, flexible, and tailored to users' needs. This tailoring will help overcome resistance to changing established workforces. The burden of care imposed on patients and their families must be considered, but new knowledge and competencies can be empowering for clinicians, patients, and carers alike. Just as COVID-19 has accelerated digital literacy, so too telehealth can accelerate health literacy. In envisioning a telehealth-enabled future, one must remember that many clinical conditions require physical examination or interventions, and that care is human and a relational activity. Industry needs to develop technologies that work for clinicians and patients and adapting healthcare systems and lifestyles to fully exploit this technology. Now with that, my presentation is over. I will show you some of the case studies that we have done at HGPGI in the field of telemedicine and digital technology. Before this, collaboration was established between HGPGI and IIT Kanpur, and the MOU was signed on 29th of June 2021. We suggested that the facilities created in the School of Telemedicine and Biomedical Informatics at HGPGI can immediately help IITK to launch this center of excellence that they are envisaging to develop along with the School of Medical Research and Technology. So I'll show you some of the facilities that we have developed in HGPGI under different grants. This is the immersive lecture theater, and for you it is very easy to understand and need not have to explain these things. So here you have make the audience immersed in the digital operation space, and we bring in all kinds of technologies to make them understand as if they are present in the operation theater to observe the procedure. This is the digital operation theater, and we have experimented on telestations. You can see there telestations, and also giving telementoring solutions using this facility. We also use some of these mobile health technologies like mobile broadband internet, and to demonstrate from rural areas how they can transmit surgery pictures, and we can give them some advice. Another program we have developed is the networking of medical colleges of India. 50 medical colleges have integrated on the National Medical College Network under the NMCN National Medical College Network project of Government of India. It is still running, and HGPGI was made the National Resource Center for that. This is the workspace we designed for a virtual tumor board. Here we can see a cancer patient or any patients who require multi-specialty involvement. So in a video wall, we can have all the inputs coming from peripheral hospitals, and the physicians from different specialties gather and they discuss about the patient and suggest the peripheral hospital after studying the clinical material and as well as investigation findings. This is the ecosystem where in the outpatient department, the surgeon giving tele follow-up advice to patients coming from far places. This is an example where I'm giving a tele follow-up services to patients from Odisha, and this kiosk was wheeled in to the OPD from 1 o'clock till 3 o'clock after finishing the routine OPD to give tele follow-up services. We have also systems of this large display platforms where we can really put large X-rays, MRI, CT scans, angiography, and give consultations to the remote locations. This is an e-learning center where you can see a large video wall is there, and a group of 25 students can be participating in any telesurgical or tele-interventional procedures, which is not possible by going to the intervention suite. This is the data center where knowledge parking is done. And this is one of the snapshots of KEM Medical College, where in the National Medical College Network, they are participating in some of these knowledge sharing exercise. This is one of the projects where we have deployed a kiosk, like we have placed a kiosk in the health center of IIT Kanpur. Similar kind of kiosk we have placed in the NTPC hospital in Maja in the Uttar Pradesh state, very remote areas. And this is under a CSR project. And we get consultation from there. This is all-in-one device. Anybody interested to see the kiosk can go to the health center here, and it is open from 10 to 5. We also deploy telemedicine in the mobile systems in a telemedicine bus, and you can see some of the snapshots taken inside bus. And we have deployed this bus in large festivals like Kumbh Mela and other large congregation areas. And this is the dashboard we have seen in the eSanjeevani online that we regularly follow with the activities in the remote location. We are connected to 106 CSCs, community health centers from HGPJ. HGPJ is one of the hubs. In Uttar Pradesh, we have 18 such hubs that are connected to peripheral hospitals. This is one of the examples of where we are giving a teleconsultation facilities. Here is a patient who is coming with a thyroid cancer. You can see in the neck, it's a fungating thyroid cancer, where I am giving them a consultation from Lucknow. This is a regular practice, and remotely somebody helps us in doing some physical examination that we cannot do remotely. And with that, I finish my presentation. If you have any questions and clarification, I'll be very happy to answer. This is the School of Telemedicine Biomedical Informatics. All of you are invited to have a look at it.
Thank you, Professor Mishra. Rishabh, if you're around, can you please stop the screen sharing? Or else I'll do it from my end.
We have 30 minutes for Q&A and discussion.
Yes,
I'm very happy if you have a very active discussion.
Yeah, actually, we already have a couple of questions being posted.
Yeah, you can spell out, speak out all those questions. I'll answer.
Yes.
Can you make a tile, and I should have stop sharing and
we've already stopped sharing.
So we can make everybody in the screen? No?
No. So
okay, fine. Good. Okay, fine.
This is a different type of.
Go ahead.
Cool. So we'll begin with the first question. So Mr. Srinivasan, he said that he's developing a teleophthalmology solution. Is there any grant or government support for such projects? So as far as the grants and funding support is concerned, Mr. Srinivasan, please get us in touch with our team at SIIC. I have already posted in the chat box. Drop us an email and we'll be more than happy to walk you through the different funding grants which are available here at SIIC. We would like to know the technology readiness level of your proposed solution, and accordingly we'll be able to guide you. Coming to the second part of your question, the government support, sir. So, Professor Mishra, can you enlighten us on government support that can be extended to Srinivasan, who is developing an ophthalmology solution?
Okay, I am not the right person to ask. Actually, I think you answered the question, because like with the Metter Park in IIT Kanpur, you have this SIIC Innovation Center. So I think you are the right person to be contacted. There are BIRAC projects you can get grant from there.
Yes.
Otherwise, for this kind of grants, you can apply to DBT and MIT.
Right.
But let me tell you, there are a couple of solutions already developed in India on teleophthalmology. And you know that one hospital in Madurai, they already have these solutions on teleophthalmology. There are a couple of more also are available also. But if you have some innovation in that, you kindly go through that. What is already involved, developed in India and in practice, right? The Arvind Eye Hospital in Madurai, they developed an AI-based system for diabetic retinopathy. So, but if you are having, plus go through those products developed in India.
If you can send us your pitch deck, Mr. Srinivasan, that would be really helpful. Both Professor Mishra and I, along with my team, can brainstorm and then help you in the best way possible. Moving on to the next question, which is by Mr. Vibhor Chopra. So we have mobile movable healthcare kiosk where our technician goes to rural area and take BP, ECG, SpO2 and other parameters. The question is, when we use sugar machine with strip or urine analyzer for urine test, is it legal to use rapid diagnosis test without laboratory license? Can we use the strip telediagnosis system for remote monitoring?
See, my answer will be the answer to the first question is legally it is not approved till now. It's like NABL has not approved that. However, telemedicine was not legally approved before 2020. So let me tell you, if you are happy and if you have standardized somewhere or other, right? Because they are all categories based, so they are all C certified categories.
Yeah, actually, that's his next question.
Yeah, so C certified, so you can take that as a leverage and practice it. When the problem occurs, then you can face it, no problem. See, that's the way actually things work. In telemedicine also never legalized. So in 2020, March 25, before that, it's not legalized. I used to get the same question from hundreds of people when I give a lecture. So please do it. It is beneficial. And you can just, maximum you can take an agreement kind of sign declaration that these tests are treated not legalized, but need not approved by NABL, but they are C certified. At best you can do that. It's no issue.
Before, if you would like to connect with Professor Mishra offline on the similar topic, like I said, please drop an email to bioincubator@iitk.ac.in. It has been already posted in the chat box. His other question is there any license we need to obtain for telemedicine franchisee business?
No, till now this is not there, but I'm sure with this Ayushman Bharat digital mission, it's going to happen. It's going to happen very soon. So I suggest you go to the Ayushman Bharat digital mission. There is a link where you can register yourself. So please do register. And also I will request you to post both the questions. So this question as well as the previous question, that how to validate those point of care tests. So please do that.
Actually, that's a very valid question.
It's a very valid question. I will request you to put this question to the Ayushman Bharat digital mission, avdm.in.
Okay, the next question is, any special regulatory certificate needed for telemedicine deployment?
No certificate required. See, there is, it is again, it's going to come up in the AVDM very soon. Telemedicine service provider, we do not have any licensing, right? We just now take the help of these telemedicine practice guidelines and we're just deploying there. And you'll be very safe that you involved doctors and any consultation given, those be very careful about that. They are registered medical practitioners, right? And if they are from any medical stream, whether it is allopathy, homeopathy, no problem. But only thing that has to be specified. And there are also authorized legally medical practitioners. Just check that all the consultations are given by a registered medical practitioner. They have a valid license. You are quite safe in that. And ensure that your consultation is always precede with a consent. Because this is a technology-based solution they are giving. So nobody can claim that my network failed and my consultation has. So
clinicians also get a separate license for.
No, all the registered medical practitioners, they are authorized to give that. See, that is the telemedicine practice guidelines says. So please go through that. I'm sure again ABDM. I'm very happy you can put this question to ABDM again, and Ayushman Digital Mission will definitely take up this.
The next question is, could you please kindly throw some light on the legal aspects that we need to take into consideration while we test implantable sensors for remote biomedical sensing application in vivo?
See, there is no legal sanctity till now. Let me tell you very frankly, right?
Okay.
So I remember the cyber when they first introduced the chip, he introduced himself in his own body, right? So, I'll only request you that we, like today, you implant a about CGM,
Right.
blood monitor. So they have got FDA license,
Mhm.
but we do not have device license. We have been talking this thing in incubator also. We are facing the same problem every day. We don't have such agencies here in India to give license to devices. So I suggest that whenever you do such kind of things, avoid in vivo things. Better to go to surface sensors. That is much better.
Yeah.
Or you have something which is already approved by some agency like FDA.
Okay, then the next question by the same person is, we are a health tech startup where EMR is the flagship product. Is there a way by which we can connect with the government clinics, hospitals to enable digitization? Also, as Disha is still away from approval, tapping the government sector has its own set of challenge.
I'll just share you one information that all the government institutions have been asked to deploy e-hospital solution of National Informatics Center, NIC, right? So NIC has developed the solution e-hospital, and also the CDAC Noida also has another health information system management solution called Sushrut. This is being again deployed in government hospitals. They are most of their deployments are nomination basis, and they do not participate in tender, right? So I'll suggest you that you better focus on the private hospitals and mid-size hospital, mid-size clinics, and there is a need for electronic medical record because this is becoming mandatory day by day by the government, and especially the Ayushman Bharat Digital Mission is going to make it compulsory in I think years to come. So I think the best thing is don't waste your time in the government hospitals. Better to go for and most of the large hospitals, they have large vendors to take care of their health IT solutions. Better to go for mid-size and small clinics. So in tier 2, tier 3 cities, I think you'll be successful in that.
Okay. So with this, we come to the end of the questions which are being posted in the Q&A box. If someone would like to raise a hand and ask any question to Professor Mishra directly, I would request you to please raise your hand. There's a button at the bottom of the screen which you can click and raise your hand. It will let you speak and ask your question. Sure, Vibhor, as I said earlier, and I've also posted in the chat box, the email ID is bioincubator@IITK. So you please feel free to drop us an email and we will be more than happy to connect you with Professor Mishra. Okay, if does anyone have any other question? Cool. Vibhor, would you like to have a one-on-one with Professor Mishra right now? We can give the speaking rights to you. You can post your answer in the chat box if you want. Okay, so should I unmute you, Vibhor? Manaspata, you are the host, right? Click on Vibhor's name and give him permission to unmute himself. Vibhor, you can unmute yourself and ask a question.
Hello.
Yes, Vibhor.
Hello.
Vibhor, we can hear you.
Hello, ma'am, can you hear me?
We can hear you. We can hear you.
सर मुझे तो बेसिकली मेरे क्वेश्चंस का आंसर मिल गया है। बेसिकली सर मैं क्या मोबाइल हेल्थ कियोस्क कर रहा था इसमें, और बस यही इशू आ रहा था। सर इशू यही आ रहा था कि जैसे हम यूरिन के लिए, शुगर के लिए, लिपिड प्रोफाइल के लिए, हीमोग्लोबिन के लिए सर स्ट्रिप सिस्टम यूज कर रहे हैं। तो वही सर कि हमको ये लीगलिटी का इशू आ रहा था कि लीगली है या नहीं है, इसके रिगार्डिंग मैंने क्वेश्चन।
मैंने आपको आंसर कर चुका हूँ दैट इसमें नो आंसर टू दैट because our legal agency in India for lab is NABL. You have to be NABL certified, right? Your hospital is NABL certified. So these kind of solutions are not.
Hello.
Can you hear me?
I think before you're having a patchy internet, you're having bandwidth issue. Are you in transit or something? Before we can hear you, can you hear us?
मैम मेरी आवाज आ रही है आपको?
आपकी आवाज आ रही है बिफोर हमको।
ना आप सुन सकते हैं हम जो बोल रहे हैं? Can you hear us?
I think he's having.
हेलो।
ना आप सुन सकते हैं? हमने कुछ बोला आपको? आप
जी जी।
आपने सुना कि नहीं? क्या बोला मैंने? Hello.
I think he dropped out, sir. He's having.
I think we lost him because of the internet issues.
Yeah. With this, I guess, sir, we come to the end of this session. Minister, would you like to give an official word of thanks?
So, sir, thank you, sir, for your insights. And telemedicine will most likely be at the cutting edge for the future healthcare services and assisting humanity to lead the quality lives. Now, I would like to also thank the audience for putting up their questions and interacting with us. And so we are now in the final segment of the webinar. So on behalf of SIC Kanpur, I would like to extend my gratitude to sir for inspiring us with his experiences and findings. Thank you so much, sir. Thank you, ma'am.
Thank you. Thank you, Minister.
Thank you so much.
Yeah, thank you, everyone. Bye-bye. Take care.
I'm ending the session. Thank you, sir.
Okay.